is ready to go.
How's it going, guys?
I hope the lunch was good for everyone. So children make up 33% of Pakistan's population, but they make up 100% of Pakistan's future. Last year alone, 640,000 infants died. That's 640,000 babies before they even hit their first birthday. And that's because of preventable causes. The average Pakistani woman becomes a mother for the first time between ages of 16 and 24. And the chances of her dying in childbirth is 25 times higher than any other woman in this auditorium today.
So we realized that the scale of this problem is massive, and the question is, how are we going to solve it? Well, there's one thing in Pakistan that almost everyone has: cell phones. And rural Pakistan is no different. In rural Pakistan, we have an 83% penetration rate of households who have access to mobile phones. So we knew that we had to leverage this asset, and our first instinct was to use an SMS-based approach. Let's send mothers maternal health information via SMS. But the problem is literacy. There's no point of us sending SMS messages to people who can't read them. So we knew that the solution had to be voice-based. And that's exactly what Mama Alliance does. They send voice messages to mothers in rural areas to help them learn about maternal health. And they have a validated model, and it's been really successful in a lot of countries. But they never got to Pakistan, and we wanted to find out why. And we got the answer from Hassan Sandila, who's the head of partnerships at Telenor Pakistan. He told us that because he's focusing on his mHealth initiative, he's been working with Mama. But he's had to reject 50% of their content simply because it's not culturally sensitive, and it is offensive to the Pakistani demographic.
So cultural barriers are one of the challenges that affect maternal health in Pakistan. The others are limited access to healthcare providers. There's also a lack of maternal health knowledge overall. And additionally, specialized services are often offered in Urdu or Punjabi and not the other regional languages. Given these challenges, the solution is very simple. We're providing the first ever voice messaging service to educate and empower pregnant Pakistani women in rural areas.
And the way that it works is simple too. All a mother has to do when she finds out that she's pregnant is subscribe to the Ammi service. She enters in her due date, and based on that, we send automated voice messages based on exactly where she is in her pregnancy, all the way from conception to the child's first birthday. What's even better is we talked about Mama Alliance just now. In the past 30 days, we've secured a partnership with Mama Alliance. They've given us access to all of their content, and we spent the past month converting it into the Urdu language and also recording it. We've already recorded all of it until the actual birth of the baby. And what's even better is that Telenor Pakistan just last night gave us the green light and screened all of our content and said that they're ready to put it on their outbound dialer in Pakistan. Right? And this is a quick example of what an existing message might look like using the Mama Alliance. And we're basically making a halalified, Pakistani-friendly version of this message that would be less offensive to the end user. And the way that we're doing this is using a back-end outbound dialing service called Vervoice. And this is what makes our idea especially exciting. 63 cents. 63 cents is the cost of delivering this service to a mother all the way from conception, all the way to the first birthday. 63 cents is all it takes to dramatically alter the life of a mother and her child in Pakistan. And when we look at the alternative solution, we're ready to enter the market at a much cheaper price. Telenor's current mHealth solution is 3 rupees a week. We're ready to enter at 3 rupees a month.
So right now, there's 2.8 million pregnant women in rural Pakistan. The challenge was, how are we going to get to them? How are we going to build trust with this community? And we realized that we're not going to reinvent the wheel. What we decided is to capitalize on the pre-existing pathways to get to each woman. At this point, every woman has 3 points of contact. She has the medical professional, who is the doctor. She has the non-medical lady health worker, who is a woman from her community. She's trained in basic health practices. And she has the non-medical traditional midwife, called the Dai in Urdu. So we've partnered with these 3 groups to promote our service and get directly in touch with every woman. So this is a proven model in many other developing countries, and we are ready to bring it to Pakistan now, and that's where we're looking for your help. We're ready to launch a pilot project in a village in Punjab called Satyana. We've built the partnerships with the agricultural officer there. We've built a partnership with the provincial coordinator of the family planning and primary health care program.
So in terms of our team, we have an awesome stacked number of people that are ready to work on this idea, and we have a series of diverse backgrounds. We're looking forward to telling you more about us during the Q&A session. In addition to that, we've spent the past month securing partnerships with a series of different stakeholders, from NGOs, people in the healthcare space, and also people that are very successful in social innovation. But most importantly, children are the future of any country, and Pakistan should be no different. Let's change the way that we communicate with them, change their future, one call at a time, using the Ammi service. Thank you.